Good day, Dr. Blake. My name is Kosanyo Bunam. In this video, I'll be performing head-to-toe assessment. Here is 360 view of my room. Okay, I'll start with washing my hand. I'll wash my hand. And I'll clean my stethoscope. Hi, my name is Kosi, and I'll be doing head-to-toe assessment on you. Is that okay?
Yes, it is.
Okay, can you please tell me your name and your date of birth?
My name is Rose. My date of birth is April 6, 1996.
All right, I have the right patient. I'll provide some privacy for you. Okay. On general survey, my patient maintain good posture in sitting with arms relaxed on the laps. No obvious respiratory distress. Well, the well-nourished, the sexual development is appropriate for the age and gender. She looked the stated age. The skin is well-nourished, well moisturized. There is no obvious lesion of the skin or scar. The body parts are equal symmetrical. She maintains eye contact. Speech is clear and understandable. The speech is clear and understandable. She appears clean and well groomed. The dressing is normal for the weather, and the mood and behavior is appropriate for the situation. Can you please stand up and walk? Thank you. Come back. The gait is normal, smooth and balanced with symmetrical arm swing, no obvious gait deformity. Do you know where you are?
I'm at home.
Do you know the time?
It's about 6 p.m.
Okay. Do you know the date? Today's date?
Today is April 6, 2022.
Okay. The patient is alert and conscious in time, place and person, well oriented in person, place and time. Okay, I will start my assessment with looking at the head. The head is normal cephalic. There is no swelling of the head. There is no lesion, no lump. There is any pain?
No.
No tenderness. Then the scalp. I will look at the scalp. The scalp is well moisturized. The hair is fine and brown. There is no obvious hair loss. The hair distribution is even for her age. I will look at the face. The facial features are symmetrical. There is no involuntary movement and there is no muscle weakness. I'll assess for the facial cranial nerve 7 facial. Can you raise your eyebrow? Good. Can you close your eyes? Fine. Can you smile, please? Frown. Pop your cheeks, please. Good. Cranial nerve 7 facial nerve is intact. I'll palpate the face. The face is now warm and there is no area of tenderness. Then I'll assess the eyes. The eyebrow is symmetrical. The eyelash is equal and even, is full. There is no discharge from the eyes. There is no ptosis of the eyes, of the eyeball. There is no protrusion or sunken appearance of the eyeball. I'll look at the sclera. The sclera is white and the conjunctiva is pink. I will do the assessment of the cranial nerve 3 oculomotor, and I will start with assessing the pupil. Checking the pupil size. Can you open your eyes wide? This is 4 millimeter. 4 millimeter. Is equal 4 millimeter on both sides and is round. The pupil is round. Okay. I want to check for reaction to light from the side to the front, from the side to the front. The pupil will react to light by converging and constricting. I'll check for accommodation. Can you look at this pen? From this distance, I can see that the pupil is dilated. Then coming closer to the nose, it constricts and converges. This shows that the cranial nerve 3 oculomotor is intact. I'll assess the nose. The nose is at midline. There is no discharge from the nose. The septum is at midline and not deviated. There is no perforation of the septum. I'll assess for the sinuses. I'll check the frontal sinus. Tell me if you have any pain.
No pain.
No pain. The maxillary sinus.
No pain.
There is no pain except the pressure from my hand. Then I will check for the ear. I will assess the ear. Looking at the ear is symmetrical. There is no discharge from the ear. Then I will palpate the tragus. Any pain?
No.
Then the auricle. Any pain?
No.
There is no area of tenderness. I'll perform the hearing test. I want to whisper something to you. You tell me back what I said, okay?
Okay. 1, 2, 3. 1, 2, 3.
I can see that there is no obvious hearing loss of the patient. I'll assess the mouth. The lips are pink, well moisturized. There is no obvious bluish or discoloration of the lips. Can you open your mouth, please? The gums are pink. The mouth is well moisturized with saliva. There is no bleeding into the gum. There is no swelling or lesion of in the mouth. Can you raise your tongue, please? The base of the tongue is well moisturized with saliva. Bring it down. And the tongue is at midline. At this point, I want to perform the gag reflex to test for the cranial nerve 9 and 10. Open wide. Say ah. Okay. On saying I can see that the uvula and the soft palates are raised and at midline. Can you please stick out your tongue? Okay, move it to the side and to the other side. Good. Can you please say light, tight, dynamite?
Light, tight, dynamite.
Okay. I can see there is no tremor of the tongue, and the tongue is at midline and not hypertrophied. This shows that the cranial nerve 9, prosophalangeal, cranial nerve 10, radius, and the cranial nerve 12, hypoglossia, are intact. I'll assess the neck. On assessing the neck, there is no lesion, there is no swelling, there is no obvious swelling. The neck muscles are symmetrical. Palpate is not warm to touch. Any pain? No pain. Then I'll palpate for the trachea. The trachea is at midline. Then the thyroid gland is not palpable. I'll check for the carotid pulse, one at a time. I will hold it for 1 minute. The pulse rate is 80 beats per minute. The reading is regular and the strength is 2+. Okay, I will check for the cranial nerve 11, spinal accessory nerve. Can you turn your head to the right? Good. Can you turn to this way? Okay. Can you raise your shoulder? Cranial nerve 11, spinal accessory is intact. I'll assess the upper limb. The skin is well moisturized, well nourished. There is no obvious lesion of the skin. There is no scar. The tone is normal and the body parts is equal. It's not one to touch. Any pain? No area of tenderness, no swelling. I'll check for the capillary refill. The capillary refill within 1 to 2 seconds. Then I will check for the pulse, radial pulse on both sides. I will hold for 1 minute. The rate is 80 beats per minute. The rhythm is regular and the strength is 2+. Then I will check for the brachial artery on both sides, holding for 1 minute. The brachial artery, the rate is 80 beats per minute. The reading is normal and the strength is 2+. Now I will do some range of motion. Can you stand up, please? Good. Can you flex your fingers? extend, flex your wrist extension, ulnar deviation, radial deviation, elbow flexion, elbow extension, pronation of the forearm, supination of the forearm, abduction of the shoulder, abduction of the shoulder, external rotation of the shoulder, internal rotation of the shoulder. Did you feel any pain anywhere?
No.
Okay. The range of motion in all the joints of the upper extremity is full and pain-free. Can you grip my hands? Okay. Tight, good. Good, tight, good. And the grip strength is strong. Sit down, please. I will assess the lower limbs. The muscles of the muscles are equal bilaterally. The limbs are equal. It is well moisturized. There is no obvious lesion. I will check for the palpation is not warm. There is no tenderness. I will check for the capillary refill of the lower limb. Is refilled within seconds, 1 to 2 seconds. Then I will palpate for the arteries, pulse of the lower limb, palpating the dorsalis pedis artery for 1 minute. On the right, I'll palpate for the left. The rate is 80 beats per minute. The reading is regular and the strength is strong, 2+. I'll check for the posterior tibialis on both sides for 1 minute. The rate is 80 beats per minute. The reading is regular and the strength is 2+. Then I will check for the strength. Put my hand down, plantar flexion, then up, dorsiflexion, plantar flexion, dorsiflexion. The strength of the lower limbs is equal and strong. The range of motion is full and pain-free. Okay, I will check for the posterior thorax. Can you turn your back, turn around? Okay. On inspection, the neck muscles are symmetrical, the scapula is symmetrical, the spinal process is at midline, there is no scoliosis or kyphosis, no deviation, no obvious abnormalities found. On palpation, it's not warm. Any pain?
No.
There is no area of tenderness. Then I check for the chest expansion. Breathe in, out. There is symmetrical chest expansion. Then I will percuss the lung fields. On percussion, the normal resonance is felt on all the field. Then I'll auscultate the vesicular and the bronchovesicular sound. Vesicular, breathe in and out, in, out. Vesicular, breathe in, out. Bronchovesicular sound, breathe in, out. Bronchovesicular, 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 in, out. Vesicular, 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 in, out, in and out. Vesicular. The Vesicular and bronchovesicular sounds are heard in all the lung field, and they are normal. There is no additional breath sound heard. There is no wheezing. There is no crackle. Okay, I will check for the pulse respiratory rate. Breathe in, out for 1 minute. The rate is 15 beats breath per minute. Okay, can you come face me again? Thank you. Then I will assess for the chest. The chest muscles are equal. There is no lesion of the chest muscle. There is no scar tissue. On palpation, this one to touch. I will check for the anterior posterior versus transverse ratio. This is anterior posterior. This 1, and this is 2. So 1:2. Anterior posterior to transverse ratio is 1:2. I will now listen to the heart sounds. Starting from the right, second intercostal space, that is for the aortic press sound. Left second intercostal space for the pulmonic. The third left intercostal for the S point. The fourth left intercostal is for the tricuspid. And the fifth left intercostal mid-clavicular is the mitral. I'll equally check for adventitious sound. There is no murmur. There is no additional sound. Then I will check for the apical pulse. I will hold it for 1 minute. The apical pulse is 80 beats per minute. The reading is regular, and the strength is 2+. The S2 sound is loudest at the base of the heart, which is between the aortic and the pulmonic valve, and the S1 sound is loudest between the mitral and the tricuspid. Okay, so can you please come to the break? I will assess for the abdomen. I will drape my patient. Then the abdomen is round and flat. There is no lesion, there is no masses, there is no pulsation of the abdomen. I will listen to the sound, starting from the lower right quadrant, upper right quadrant, upper left quadrant, and lower left quadrant. On also auscultation, there is no gurgle sound is heard in all the quadrants, normal bowel movement. Then I will percuss. Right lower quadrant, right upper quadrant, left upper quadrant, and left lower. There is stiffening movement sound in all the tympanic sound in all the quadrants. Then I will palpate. Starting from the right lower quadrant, I'll palpate the right upper quadrant. I'll palpate the left upper quadrant and the left lower quadrant. The abdomen is soft and not painful. Okay, you can stand up. This brought me to the end of my assessment, and I will show you the 360 view of my room. Thank you.